The Lagos State government, in collaboration with the United Nations Children's Fund, UNICEF, has engaged journalists and mass media practitioners as it prepares to launch a statewide immunization campaign targeting yellow fever and other vaccine-preventable diseases. This massive initiative aims to vaccinate over 95% of residents across the state. The campaign, set to begin October 19, 2024, is poised to be one of Lagos State's most extensive immunization efforts to date, targeting over 80 million residents aged between 9 months and 44 years. Gathered at the STO Resource Center in Alausa, Ikeja for the orientation program, journalists from reputable media houses got briefed about what is required to get the job done.
Gentlemen of the press,
in his keynote address, Dr. Abimbola Bowale, Supervising Permanent Secretary of the Lagos State Primary Health Center Board, LSPHCB, emphasized the importance of achieving a minimum vaccination coverage of 95% to close existing immunity gaps.
Immunization is the first line of defense in strengthening the health indices of a family, the healthcare system, and the society as a whole. The role you play in disseminating accurate and impactful information is pivotal in our collective effort to ensure that every child receives life-saving immunizations with no one left behind. The influence you wield as press in shaping public perceptions and behavior cannot be overstated. Non-polio SIAs are a critical component of our strategy to protect our children from vaccine-preventable diseases. These activities are not mere operational tasks. They are life-saving interventions that contribute to the health and well-being of our future generations.
Dr. Akikbelu Adetola, the coordinator of the immunization program at the Lagos State Primary Health Center Board, highlighted logistical preparation to ensure the safe distribution of vaccines, including specialized carriers and temperature-controlled storage.
For you to be able to adequately prevent measles outbreak, you need to have at least 95% of those people living there vaccinated. And once we do not achieve this, and we have a large amount of this virus in circulation, then infections tend to occur. And even in places that you have vaccinated people, when the virus in circulation is quite a lot, you may still have outbreaks. One of the major reasons that has been identified for low vaccination coverage for the measles vaccine is, of course, systemic issues. Our healthcare workers, we do know that they need to improve their attitude. Rumors, myths, misinformation. One of the major rumors around measles is the fact that a child that has had measles should not take injections, should not take any vaccines. And this is something that is deeply ingrained in our society. This myth and misconceptions has been a major driver against the uptake of the measles vaccine in the states and in the country at large.
UNICEF representative Ms. Aderonke Akiola delivered a presentation emphasizing the critical role of media in promoting vaccine safety and combating misinformation. She highlighted a decline in public trust due to vaccine myths and called on the media to work as partners in spreading accurate, reliable information to the public.
Can you remember doing COVID-19 vaccine? The people that did that video, putting after the COVID-19, put their phones and said there's a magnetic connection between the COVID-19 vaccine and the phones. Who can remember? Who can remember the light bulb? I have, thank you, you're in the spirit, 5G. People actually sat down, did that video. What were those guys doing? Were they misinforming or disinforming? Disinforming, fantastic. Now, for my mom, who is a part of the Concerned Parents Association of Nigeria, who decided to say, I know your organization pushes for vaccine, but before you take it, be careful. Be careful. See what I saw. What is she doing? She's misinforming because she's not actually doing it with the intention to hurt, but out of concern or saying, oh, I'm trying to actually verify. And when we look at some of these states, most times we all, at one point or the other, would have formed a part of the people who misinform. You know why? Because sometimes when people that are misinforming, like the Sundays of the HPV vaccination in Lagos, Sunday, that spoils all our efforts, right? When they do that, what we try to do is, I want to share with my friend. Somebody I even share it on the health media platform to clarify whether this information is true. When you are trying to clarify, what you are doing is what? You are misinforming. Spread the correct information consistently and correctly. What you say today must be consistent with what you say tomorrow. If you are not sure, don't say anything. And we always say, let it be concise. Keep it short and simple. People don't want too many words. People are burdened with so many things. So people don't want reading. After a while, they lose concentration and they lose attention.
During the event, media practitioners were divided into groups to discuss strategies for increasing awareness and reducing misinformation. This discussion produced several workable solutions, including grassroots community engagement and active involvement of religious and traditional leaders in spreading the message of vaccine safety.
There are two other points that we highlighted. We talked about timing. When you visit in the morning, don't make it a one-off thing. You can still go back, or another set of group should revisit the same street that you have gone to. Because the people you miss in the morning, you may likely meet them in the evening. Praise the Lord. Another vital point we raised is about who is checking the field workers. It's very, very key. You know, we are all human beings. Some of them display like that kind of attitude. Send them to go to this direction, they go halfway, then they will tell you they've done it. There must be somebody, supervisor, who is checkmating them, who is looking after them.
By the time you go into you hear all these programs, thousands of people, we hear more about it. So that's why we believe that your engagement is very, very key. You still need to sensitize it so that you'll be able to, pass correct and accurate information to the community.
As Nigeria continues to grapple with rising cases of yellow fever and measles, with over 8,000 confirmed measles cases recorded in the first half of 2024 alone, the urgency of the campaign is clear. This initiative is seen as a significant step in preventing further outbreak and ensuring a healthier future for Lagos residents.
The media orientation is a call to action by the media practitioners to help us, make public and to popularize vaccine safety and acceptance. We see a decline in vaccine trust and acceptance owing to a lot of rumors being populated. And so we need a channel where people, as much as they hear the rumors, they also combat those rumors through trusted platforms. And that is why this meeting has been called, because we realize that the media is a voice that reaches the voiceless and a platform to reach many. Hence the reason for this meeting. We want to gain allies from media practitioners to help us use their platforms, their channels and their network to increase vaccine safety, to increase vaccine trust and acceptance.
Over the past 2 to 3 years, we've been having several outbreaks of vaccine-preventable diseases, measles, yellow fever, diphtheria, even of recent cholera, and that tells us that we are having immunity gaps in the community. And the easiest way to close that gap is to have a statewide immunization activity while ramping up our routine immunization process in the states.
We have a number of vaccines that we want to give to our children, and this includes one, yellow fever from 9 months to 44 years. So adults are also eligible for yellow fever vaccine. We also have measles from 9 months to 18 months, and so that is basically for our children. And then, of course, we have HPV vaccine that covers from 9 years to 14 years. So for the other routine immunizations, they also continue to go on, like oral polio and the rest.
The campaign is not only a public initiative but also a vital effort to restore public confidence in vaccination programs and safeguard the health of future generations.
Lagos mainland, are you ready? The time is here. It's the MSME fairs for local, regional, and international brands and products in Lagos State. Are you a business owner, entrepreneur, or business executive? Then this exhibition is for you. It's another great opportunity for micro, small, and medium-scale business operators to network and gain international attention, as well as free media coverage of their products and services. Date: Monday 21st to Friday 25th of October 2024. Venue: Center for Management Development, CMD, Shangisha, Magodo, Lagos. For participation, please call 0806 560 5990 or 0813 055 5199. Facilitated by Honorable Moshood Olanrewaju Oshun, representing Lagos Mainland Federal Constituency as the National Assembly. Smidan, putting made in Nigerian products at the front burner.